A reflection on the personal nursing philosophy. Introduction. Nursing philosophies guide practitioners to meet the changing health needs of their patients. Such models must be guided by appropriate concepts, meta-paradigms, and assumptions to deliver high-quality patient support. This paper gives a polished summary of my nursing philosophy. A personal reflection of the model is also presented. Polished personal philosophy. My philosophy as a practitioner is to develop evidence-based models and use clinical concepts to offer high-quality and holistic patient care. The model is informed by the 4 meta-paradigms to achieve desirable outcomes. Some of these approaches include continuous learning and cultural competence. I consider certain values such as integrity, ethics, and confidentiality to achieve positive results. Practices such as leadership, teamwork, collaboration, and empowerment guide me to deliver quality care to my patients. The meta-paradigms of nursing are applied in such a way that it is artistic and informed by emerging knowledge or evidence. The ultimate goal is to meet the needs of diverse populations or individuals. The practice is usually undertaken to repattern patients' energy fields and health. The responsibilities of nurses, codes of conduct, and ethical attributes are taken seriously to ensure my patients receive appropriate medical support. The desire to expand the designation of the 4 meta-paradigms of nursing and embrace various methods such as the use of traditional medicine will make me a skilled practitioner. I will also consider the need to revise various concepts such as health and environment in an attempt to improve my philosophy and empower every patient. Personal reflection. My nursing philosophy has unfolded in such a way that it resonates with the attributes of the practice. For instance, I acknowledge that nursing is an art and a science. This understanding has led to numerous developments that inform my practice. I use scientific knowledge and evidence to develop personalized care delivery models. The meta-paradigms of nursing and certain concepts such as cultural competence and evidence-based practice contribute to the scientific aspect of philosophy. I acquired new approaches that can improve the art of nursing and interact with every patient at a human level. Some ideas have challenged my values and assumptions. For example, the issue of euthanasia has become common in the recent past. Some colleagues believe that the idea is appropriate for both patients and caregivers. However, I believe that human life should be respected by all. Values such as respect, justice, and equality are used to inform my practice. However, ideas such as autonomy and confidentiality have challenged those of mine because they appear to promise superior services to different patients. Several ideas have caused me personal conflicts. For instance, I have been using multidisciplinary teams to support my patients' needs. The nurse-patient relationship care model also appears to challenge my views. The approach can maximize the health outcomes of critical care patients. Similarly, patient autonomy ensures that individuals receive desirable and personalized care. However, sometimes my ideas diverge from those of my patients. For instance, a patient might demand a specific service that can have adverse health implications. The issue can affect the quality of care available to the individual. In such a situation, it becomes necessary to deconstruct my dispositions. I will develop evidence-based models that can empower me to compromise and deliver enviable patient care. I have taken several actions that illustrate my philosophy of nursing. To begin with, I engage in lifelong learning to acquire evidence-based insights and concepts that can be applied in different healthcare units. The practice equips me with appropriate theoretical concepts, science, and care delivery approaches, art, that can be used to improve the philosophy. The acquired conceptions are used as guidelines whenever providing patient care. I establish teams composed of professionals such as practitioners, psychologists, physicians, and caregivers. Such teams deliver personalized care to patients with diverse needs. I examine my patients' physical, emotional, spiritual, and mental needs. This approach guides me to provide culturally competent and holistic care. I have my definitions of the 4 nursing meta-paradigms. The person is any individual in need of holistic medical support. The environment is the totality of different factors that dictate a person's health. Nursing is an artistic practice guided by scientific knowledge. Health is an unwavering state of wellness for all people, including those with terminal diseases. Finally, my first nursing philosophy has changed significantly over the years. One of the noticeable changes is that I have expanded the definition of the 4 meta-paradigms. For instance, the concept of a person has been widened to include communities. The meta-paradigms of the environment now include cultural attributes and behaviors. My assumptions now capture different concepts such as cultural competence and lifelong learning. Every care delivery role is studied and analyzed critically to improve my philosophy. Conclusion. The ability to offer high-quality care and learn from my mistakes makes it easier for me to improve my philosophy. The application of emerging concepts in my nursing practice explains why I always meet my patients' needs. This discussion, therefore, reveals that a practitioner's philosophy should be updated periodically to address the emerging needs of more patients.